Performing venipuncture. Before performing venipuncture and initiating an infusion, verify the healthcare provider's orders and gather the necessary equipment and supplies. Provide for patient privacy. And perform hand hygiene. Introduce yourself to the patient and identify him using two identifiers.
Hi, my name's Jillian. I'm going to be the nurse taking care of you today. Can you tell me your name and date of birth, please?
Michael Ferguson, 31060.
Okay. Do you have any allergies to any medications or anything that we need to know about?
No.
We're going to be starting an IV today. We're going to do your right arm. You're left-handed, correct?
Yeah.
Okay. We're going to do your right arm today. Do you have any questions?
No.
Before performing venipuncture and initiating infusion, prepare the IV solution and the insertion site, as shown in the video skill, Preparing the Infusion Site. When you're ready to perform the venipuncture, cleanse the site with chlorhexidine prep, and then reapply the tourniquet 4 to 6 inches or 10 to 15 centimeters above the intended insertion site.
Doing okay?
Check for a distal pulse and apply gloves. If chlorhexidine is contraindicated, use tincture of iodine and iodophor or 70% alcohol. The skin should always be allowed to completely dry before venipuncture, usually 1 to 2 minutes. You may apply a topical anesthetic to the site if prescribed by the provider.
Okay, Mr. Ferguson, I'm going to let you know when we stick, okay?
Anchor the vein 1 to 2 inches distal to the site by placing your thumb over the vein and gently stretching the skin against the direction of the insertion. Ask the patient to relax his arm. Caution him that he'll feel a quick stick. Insert the vascular access device. Bevel up at a 10 to 15 degree angle, slightly distal to the actual site of the venipuncture in the direction of the vein. Watch for blood return in the flashback chamber of the catheter, which indicates that the bevel of the needle has entered the vein. Lower the catheter until it's almost flush with the skin. Then, advance the catheter about 1/4 of an inch into the vein and loosen the stylet of the over-the-needle catheter. Continue holding the skin taut as you stabilize the needle and apply firm but gentle pressure to the vein 1 inch above the insertion site. Advance the catheter off of the needle to thread just the catheter into the vein until the hub rests at the venipuncture site. Don't reinsert the stylet once it's been loosened. As you advance the catheter, activate the safety mechanism if it does not activate automatically. This technique will vary somewhat depending on the product you use, so be sure to follow the manufacturer's guidelines. Stabilize the catheter with your non-dominant hand, being careful not to contaminate the insertion site, and release the tourniquet or blood pressure cuff with the other hand. Attach the extension set and release manual pressure on the vein. With the pre-filled syringe attached to the extension set, aspirate to assess for blood return. Then, slowly inject saline while assessing for infiltration at the insertion site. After confirming placement, remove and discard syringe. Do not touch the point of entry or open catheter hub. Then, secure the connection.
Doing okay?
Yeah.
To begin the primary infusion, vigorously cleanse the needleless adapter and connect the primary IV tubing. Begin the primary infusion by easing open the slide clamp or adjusting the roller clamp of the IV tubing. Follow up by securing the catheter and applying a dressing as shown in the video skill, Dressing the Infusion Site.